Have you noticed that climbing stairs feels more demanding than it used to? Maybe your legs feel heavier, your knees complain, or you pause halfway up and wonder when this became difficult? If that sounds familiar, stay with us, because what you're about to discover could completely change the way you think about strength, movement, and healthy aging. Today, we're exploring 3 targeted exercises designed to help improve stair climbing ability, increase lower body strength, and support smoother movement in everyday life. These exercises focus on building the exact muscle groups that contribute most to stability, power, and confidence when walking up and down stairs. And stay until the end, because there is one overlooked movement technique that can make stairs feel easier immediately without extra equipment. As we get older, many people notice subtle changes in mobility. Walking longer distances becomes more tiring. Rising from a chair takes more effort. Going downstairs can feel less controlled. These experiences are incredibly common and often linked to changes inside the muscles themselves. One of the major contributors is age-related muscle decline, commonly referred to as sarcopenia. This process gradually reduces muscle mass and strength over time. Although it can begin early in adulthood, the effects often become more noticeable after the age of 50 and may continue progressing if muscles are not challenged regularly. Why does this matter for stair climbing? Because climbing stairs depends heavily on lower body strength, coordination, balance, and controlled force production. Your body must generate enough power to lift itself upward while also maintaining stability and safely lowering itself back down. The muscles doing most of this work include quadriceps at the front of the thighs, gluteal muscles at the back of the hips, hip stabilizers along the sides of the pelvis, supporting muscles around the knees and core. The encouraging news is that muscles remain adaptable throughout life. Research consistently shows that progressive strength training can improve muscle function and physical performance in older adults. Think of your body like a machine that responds to use. If movement decreases, systems become less efficient. But when muscles receive regular, manageable challenges, they adapt. Strength can improve, movement can become easier, confidence can return. Before we reveal exercise number 1, ask yourself this question. When was the last time you intentionally trained your muscles to make daily activities easier? Most people exercise to look different. Very few exercise specifically to move better. That difference matters. Exercise number 1 focuses on one of the most practical movement patterns in daily life: the controlled sit to stand. This movement trains the muscles responsible for standing up, stepping upward, and maintaining lower body strength. To begin, sit on a stable chair. Place both feet about shoulder width apart. Move toward the front edge of the seat. Position your feet slightly behind your knees. Cross your arms forward if comfortable. If balance is limited, keep your hands near armrests for support. Now stand up. As you rise, concentrate on pressing through the feet and activating the thighs and glutes. Once standing, pause briefly. Then slowly lower yourself back into the chair. The lowering phase matters. Moving slowly downward increases muscular demand and encourages controlled strengthening. A helpful rhythm: rise with intention, lower with control. One complete cycle equals 1 repetition. Aim for approximately 10 repetitions per set and perform 2 or 3 sets throughout the day if comfortable. One of the most common mistakes is using momentum. People often swing forward and launch upward. but momentum reduces muscular effort. Instead, imagine every repetition as practice for moving efficiently in real life. Quality beats speed. In a moment, we're moving to a muscle that many people never train directly, even though it quietly determines whether you feel steady or unstable on stairs. Exercise number 2 strengthens a key stabilizing muscle. The lateral step up. This movement targets the hip stabilizers that help maintain balance and reduce unnecessary shifting during movement. Start with a low step, even a small platform works. Place one foot fully on the surface, push through that leg, bring the opposite foot upward, then lower back down carefully. Repeat. Focus on staying tall. Avoid leaning excessively to one side. Your goal is smooth control. The stepping leg should remain stable. Begin with 10 repetitions each side. Over time, progress gradually toward 15 or 20. As strength improves, increase step height carefully. This exercise does more than train muscles. It teaches the body to trust itself again. Improved hip stability may contribute to smoother walking patterns and greater confidence. Many people overlook these side muscles because they are not visible in the mirror, but they quietly influence almost every step you take. The third exercise may surprise you because it trains one of the most overlooked abilities in mobility, the ability to move downward with control. Exercise number 3, weighted step-down progression. This movement resembles real stair use more closely than almost any other exercise. Stand on a low step, face outward, slowly lower one foot toward the ground, control the descent, then return to the starting position. Repeat. This movement emphasizes controlled lowering. That controlled lowering creates a powerful training effect. Advanced versions sometimes include additional resistance, but only when movement quality and safety are established. During each repetition, keep the knee aligned. Avoid allowing it to collapse inward. Maintain steady posture. Move deliberately. Begin with body weight. Progress only if appropriate. Aim for 10 to 20 repetitions per side. This exercise develops strength while also improving confidence in descending stairs, a challenge many people report as more difficult than climbing upward. You've learned the 3 exercises, but there's one final technique that may instantly change the way you approach stairs. Many people unintentionally make stair climbing harder. 2 common habits: pulling excessively with the railing, trying to lift the body straight upward. Instead, consider shifting your body slightly forward through the hips as you step. This places your center of mass more effectively over the stepping foot. That small adjustment can improve efficiency and reduce unnecessary effort. Rather than fighting gravity, your body begins working with it. The goal is not rushing. The goal is positioning. Try this carefully next time you climb stairs. Notice whether movement feels smoother. Sometimes, small mechanical adjustments create surprisingly meaningful changes. And remember, strength is not only about exercise sessions, it comes from repeated practice of useful movement. Standing, walking, stepping, balancing, moving with intention. If you found value in this experience, continue building healthy movement habits and explore more wellness-focused content designed to support mobility, strength, balance, and long-term physical independence. Your body adapts to what you repeatedly ask it to do. Choose movement, choose consistency, choose gradual progress. Important medical notice: the symptoms and movement limitations described in this video can have many different causes. Anyone experiencing persistent pain, Weakness, instability, difficulty climbing stairs, or reduced mobility should seek professional medical advice and obtain a proper clinical diagnosis before deciding what treatment or cure to undertake. Never be your own doctor.